sperm, the fertilization, the fertility as itself, and now we go to the consequences of it. So most of you, or a lot of you already know her, but this is Dr. Alessandra Consales from University of Milan. We're very happy to have her today. She's a board-certified neonatologist, so looking forward to hearing that.
Thank you. Thank you, everyone. So yes, I'm a pediatrician, so I live outside the lab. I hope this presentation doesn't bore you, really. So let's dive right in and say hello to the lovely Louise. It was Louise Joy Brown. She is Louise Joy Brown, the first ever child born through IVF back in 1978. She was born thanks to the cutting-edge research of three British scientists. You see there Dr. Edwards, Dr. Steptoe, and Jean Purdy. And they really made it possible. They even chose the second name Joy for this girl, just in anticipation for the future joy of all the parents worldwide. And Dr. Edwards actually went on to receive the Nobel Prize in 2010 for his cutting-edge research on in vitro fertilization. Research that was groundbreaking, and the birth of this super babe actually made headlines all over the world, as you can see here. But it also sparked a lot of debate, both from a biological point of view and an ethical point of view. Like, we can do it, but should we do it? Like, that was the main question. Art, the technology, went on very rapidly, and indeed the parents of Louise Joy Brown actually went on to have a second baby born through IVF, and the baby, with the sister of Joy, was actually the 40th kid born through IVF, so you see. So this is Louise now. She's 47, well, a couple of years ago actually, but you get the picture. And she's written a book and a movie on her early life stages, let's call it like that, was recently made, and you can find it on Netflix, or you can find it in Italy. I don't know if here you get it. Okay, it is available, but it is a nice one. Then fast forward to this July 2025, and we may have talked already about it at the symposium, but this is little Thaddeus. He is actually the oldest baby born to date, and this is because he was born from an embryo which was frozen 30 years ago. And just to add something to what has already been said and the discussion about, I would just want to briefly tell you the story of this embryo. It was frozen 30 years ago because his biological parents could not conceive spontaneously, and so they went through the IVF procedure. And this IVF procedure produced 3 embryos. And one was implanted in the biological mother, and actually, and they had their first and only daughter. And the other 2 embryos were frozen and kept frozen. Then the mother and the father, the biological mother and father of the embryos, actually got separated, and the mother obtained custody of the embryos. So this happens in the US. Okay, so it's a different legislation, as we were saying before, but this is what happened. She obtained custody of the embryos, and she actually kept them for a long time. Then she actually went into menopause, and she wasn't unsure what to do with these embryos, and they proposed to her to donate them for research, but she didn't feel like it. And so the other option available in the US was adoption. And so she put the 2 embryos up for adoption, and after a careful selection of the parents, they were finally adopted by Thaddeus' actual parents, like adoptive parents. And that's it. That's the story, which I find pretty interesting, and I wanted to to share it with you. So we were saying that that ART is actually growing very rapidly, as you can see from this report, which is actually a very recent one. It's from 2025, although it is a report of the 2017, 2018. So it looks old, but it's actually very recent data. And it aggregates data from 83 countries and records over 6 million ART procedures over these 2 years, which resulted in 1.4 million babies in just 2 years. So considering these growing numbers, I believe, and the research community believes, that it is important to assess the potential health risks that may be faced by assisted conception children. So really, why is it important to know? Well, first of all, it is important to properly counsel parents-to-be. When parents go to a clinic asking for or simply about IVF, I think it's the right thing to do to actually try to tell them what they're about to get into. I mean, of course, success rate, of course, all the numbers that we've seen so far, but also what does the research tell us now? Okay, what do we know now about what will happen next to the child? Will it be impacted by the IVF procedure or the fact that it was conceived this way or not? So they should know what we know. Then second thing is to provide targeted antenatal and postnatal care, because of course if I know what is likely to happen both during the pregnancy and after the pregnancy to the child, I can, as a doctor, I will be better able to tailor care to the specific patient. Like, for example, blood pressure monitoring during pregnancy, if there is an increased risk of preeclampsia, for example, or growth monitoring of the fetus. Third thing, and it's stuck. Okay, third thing is actually to do better. It's pretty simple as that. That means that outcomes data actually drive quality improvement. So if I know what works and what doesn't work, if I know what gets me where, I can do better. So that's what actually brought us to the promotion of single embryo transfer, for example, and we'll see it in a couple of slides. Or we can simply choose safer protocols based on what the research tells us, what the data tell us. So continuous audit and registry feedback let us actually refine our day-to-day practice. Okay. But why should children born via IVF actually be any different from those spontaneously conceived? And I think who can actually help us answer this question is the late Professor Bacher, who came up with this theory, which is the theory of developmental origins of health and disease. And what this theory says is that conditions like the environment from conception through early childhood, very early childhood, can actually permanently shape our bodies, our organism, and how it functions. And this is mainly done through epigenetic mechanisms. Okay, so changes not to a DNA sequence, but to the expression of the genes through mainly methylation. I don't know if this is clear because it's a bit complex. I'm trying to, to simplify it. But during these early windows from conception to the first 2 years of life, when organ systems in general and the whole body is forming, the environment, that is to say nutrition, stress, infections, pollutants, whatever, can actually program how genes are going to be used in the future. And the problem arises when, you do that, the body does that based on predictions. Okay, based on the current environment, the body predicts what it's going to be, the future environment is going to find itself in. But what if these predictions are actually incorrect? Then the body is permanently set for an environment it's not going to find elsewhere. And these has been shown to be associated with the risk, an increased risk of chronic diseases. So an example, like very simple example, is fetus with intrauterine growth restriction who is not growing well because it doesn't get enough nutrients from the mother. So the body thinks that it will never get enough nutrients from anywhere, and so the genes are modified so that he will take the best from what he has. Okay, that's called the thrifty phenotype. Like everything he can find, he gets. But then the baby gets out and he finds himself in a world where there's McDonald's. And so he can have easy access to a lot of food, and this predisposes him to obesity, for example, due to these mechanisms. So back to IVF, many are the adverse outcomes that have been so far associated with ART techniques, and they are both at an intrauterine level and at a postnatal level. So as you can see here, there have been talk of reduced fetal growth velocity, or increased risk of hypertensive disorders for the pregnant mother, increased risk of preterm birth, low birth weight, congenital malformations, and then moving on, increased risk of obesity, and cardiovascular neurodevelopmental problems, and even childhood cancer. But the literature is not always concordant on these outcomes. And there are many conflicting results among different studies, and many factors, many confounding factors need to be actually taken into account when assessing the potential health consequences of IVF procedures on the children. So a wide range of factors can theoretically play a role in and affect the offspring born after ART. And although the relative importance of each specific factor related to the outcome has not been fully established yet. So here, due to time constraints, I will only talk about these ones. So let's go to, sorry about that. Okay, so let's go to the first one. So subfertility program, parental fertility problems. So assisted reproductive technology has been associated with birth defects, as we've seen in the previous slide. And in this study, the authors actually evaluated the effects of subfertility by comparing the risk of birth defects between children born via ART, children born to subfertile parents who did not undergo ART, and children who were spontaneously conceived. And what the study found was that the rate of birth defects was actually higher in the ART conceived group than in the spontaneously conceived one. But it was not different between the subfertile group and the ART exposed, let's say like that, group. So that actually raises the age-old question, which came first, was it the chicken or the egg, which meaning that is the increased risk of birth defects due to the ART procedure per se, or is it due to the parental subfertility leading parents to seek ART treatment? And actually we do not know, so I leave you with the question and the nice image. Then the authors went on to consider the possible effects, the possible association between the possible mediation of plurality, that is, multiple births. So we know that multiple births, so being born a twin, is actually associated with an increased risk of birth defects. And we know that IRT, or assisted reproductive technology, leads to, or typically leads to, higher order births, so multiple births. So the question is, can those three things be actually all linked together or not? and the authors actually found that there is a 36% of association that is association between ART and birth defects that is actually mediated by the plurality, so by being born a twin. And this degree of mediation can actually varies between birth defects, since it is actually higher for hypospadia, 39% almost, and lower for tetralogy of Fallot, which is a cardiac birth defect. So apparently it's a good thing that the proportion of twin and triplets deliveries via ART has progressively decreased over the years, and this has been mainly due to the increase in single embryo transfer. So that's something that we can actually learn from the research and do better. But so is it just these? Can the increased risks observed in ART children actually be explained only by the increased rate of multiple births associated with ART? This systematic review tried to answer this question, and it considered a lot of studies and put together the data. And what they found was actually that ART conceived twins had higher risk of being born preterm compared to non-ART twins. And the mothers had actually higher risks of developing gestational complications such as hypertensive problems and diabetes. Furthermore, ART twins had higher odds of having any congenital malformation, so that's what this systematic review actually found, and respiratory and neurological problems, and to be admitted to the neonatal intensive care unit. But ART pregnancies actually had lower odds of stillbirth, which is a very good thing, and of being born small for gestational age, another great thing, and reduced incidence of these severe complication, TTTS, is a severe complication. It's a twin-to-twin transfusion syndrome, which is a severe complication of twin pregnancies. And as a little side note, the higher rate of preterm birth among ART children was not observed after 2010. And this is possibly due to improved antenatal care, meaning that, as we were saying at the beginning, if we know and study the problem, we can actually try and find a solution. So we've covered reproductive disease, so parental reproductive problems, and number of embryo transfer. We can now move to the procedure itself, and we start with ICSI. So when ICSI was introduced back in 1992, it actually revolutionized the possibility of fatherhood for men who with poor semen quality. And its use has since then progressively increased over the years, although with regional differences, of course, and the indication for ICSI have been extended. However, ICSI is a relatively invasive ART procedure, as we've seen during the symposium, that actually bypasses several natural selection barriers in the fertilization of the human oocyte. So concerns were actually raised about the possible health consequences of children conceived using ICSI. This study compared the perinatal outcomes of children conceived using ICSI and IVF, and it actually found that children conceived using ICSI had a lower risk of being born preterm and with a low gestational birth weight compared to children conceived with IVF, although those risks were actually still higher than children conceived spontaneously. At the same time, this study also found a small but significantly increased risk of being born with major congenital anomalies following ICSI compared to IVF, in particular respiratory and chromosomal malformations, although the numbers were actually too small to actually draw any definitive conclusions. So be careful in interpreting this data. And the risk, of course, was also higher than spontaneously conceived children. So the authors, yes, you can see here. The authors actually suggested that these findings should be considered when choosing the assisted reproductive technology method for couples without male factor infertility. So just take into account these as well. But IVF and ICSI have also been associated with the development and transmission of epigenetic modifications, which are actually gene expression changes like DNA methylation that may potentially lead to imprinting disorders such as Beckwith-Wiedemann syndrome and Silver-Russell and Prader-Willi syndrome. And in this study, the overall risk of being diagnosed with any of the studied imprinting disorders by age 15 was actually elevated in children conceived using ART compared with all other children. Furthermore, the combined use of ICSI and cryopreserved embryos was the one associated with small but still elevated risks of imprinting disorders, this time independent of the parental factors related to fertility. I think this is my computer. So possible explanation for these findings. So why should the ICSI plus frozen embryo transfer actually be more associated with imprinting disorders than others? It is currently unknown. Several explanations have been proposed, among them the potential toxicity of cryoprotectants that are used to preserve the frozen embryos that may cause some methylation and structural changes to the chromatin. But it's still very hypothetical. We actually don't know anything. The only thing the research does is describe what they found. Keeping in mind that what we were saying before, there are a lot of confounding factors to be taken into account, first of all. Second of all, association does not mean causation. So simply as that. Frozen embryo transfers may actually be more dangerous. We actually don't know, but we need to ask ourselves that because the transfer of frozen embryos is an increasingly used technique both worldwide and in Europe. In Europe, as you can see here in blue, you've got the fresh transfers, in orange the frozen embryo transfer, and you see how the proportion between the two actually changed over the years. And we are progressively going towards a freeze-all strategy in many fertilization centers where they simply freeze all the embryos they obtain. And of course, you all do remember Thaddeus, so we owe it to him to keep studying and understand what goes on after the frozen embryo transfer. So to answer this question, a recent Cochrane review, so a very comprehensive review, although it only included 8 studies, but that's the numbers we're working with, found that comparing the results between fresh and frozen embryo transfer, the findings of this Cochrane suggest that there is a similar cumulative live birth rate between the two methodologies, so frozen and fresh embryo transfer, which is good. There is a reduction in the ovarian hyperstimulation syndrome in mothers, which was what the previous speaker told you about. And but there is actually an increased risk for the mother of hypertensive disorders during the pregnancy, which may reflect poorly on the baby's outcomes, of course. It is interesting, though, that this review found that children born after a frozen embryo transfer compared to children born after a fresh embryo transfer were actually larger, heavier, and there is a higher proportion of large for gestational age babies, which is apparently contradictory, because at the beginning we saw how IVF and ART procedures in general are associated with smaller babies. So smaller, like lighter babies, so to speak. And why is that? Still, we don't know. We don't answer questions, we just make more of them. That's basically it. But it has been suggested that maybe the artificial endometrial preparation that is done before the frozen embryo transfer may have something to do with it. This Cochrane review was not it was not the objective of this review to answer this question, but this study actually did. And luckily for us, and the findings of these authors supported the hypothesis that is the artificial endometrial preparation treatment on the mother that has the greatest impacts on the growth pattern of the baby, and that is associated with the large for gestational age outcome, large for gestational age risk following frozen embryo transfer. So based on their findings, and as you can see, it's the only thing that's associated, so it's not the freezing mode, the slow freezing versus the vitrification, it's not the stage at which you do the transfer, it's actually the endometrial preparation, so artificial instead of the natural cycle or the stimulated cycle. So the authors recommend considering these and avoid an artificial endometrial preparation when doing frozen embryo transfer to avoid or to minimize the risk for fetal growth disorders. Moving on, luckily for you, there's just one left, which is culture media. So does the embryo culture, so the culture medium where you put where you grow the embryo, actually influence the outcomes of IVF? These authors conducted a double-blind randomized controlled trial where they compared two different types of culture medium, this G5 and the HTF, which I think is the most used right now, and the G5 contains more amino acids and the hyaluronan, which should aid in implantation. And they found that clinical pregnancy rates were significantly higher for couples assigned to the G5 arm of the RCT of this study. But they also found that the preterm birth rate was higher in the G5 group, as well as the risk, as well as a lower birth weight, which was like more frequent in the group G5, the group where G5 was used. So the authors actually used this paper to make an important point, that is that the composition of embryo culture media should be made publicly available by the companies, which is not always the case due to intellectual property issues mainly, so economic issues basically. But, and this is actually something that also these authors from this very interesting and recent opinion paper say, that to continue to innovate, to do better, we have to be able to actually compare different embryo cultures and understand why they work, why they do not, and what they lead to in terms of children's outcomes. So we've seen the short-term outcomes more or less. Let's move to the long-term outcomes, especially in terms of neurodevelopment, cardiovascular health, oncological risk, and reproductive health. So this is a horrible slide, and I'm sorry for it, but it's about the risk of cerebral palsy among children born through IVF. So cerebral palsy is actually a group of permanent disorders of movement and posture and motor function, and which is due to a non-progressive injury or abnormality to the developing brain. Normally, CP's risk factors are prematurity. Well, actually, there are a lot of them, but among them there is prematurity, small for being of low birth weight, having intrauterine growth retardation, or genetic factors in 30% of cases, so a lot of causes, gemellarity too, all of which we have already seen as potential consequences of IVF. So this study actually found a higher incidence of cerebral palsy in singletons born after IVF, after ART, but not in twins and not in preterm infants. What does that mean? That probably IVF does not actually increase the risk for those groups that are already at risk of. It doesn't add another layer of risk to the ones already present. Another interesting thing of this study is this one here, that is that the association between cerebral palsy and ART was actually stronger in the studies before the year 2000 than in studies, than when considering studies also after the year 2000. That means that there is a progressive trend towards smaller association between ART and CP, which is actually a great thing. It means that we're doing together something right, like you from the lab and us probably when the baby comes out. And these, the authors said that this is probably also being related to the use of single embryo transfer that, as we've seen before, reduces the risk of having twins, therefore reducing the risk of having CP. This trend towards a reduction of cerebral palsy, a reduction in the association between ART and cerebral palsy, so a reduced risk of cerebral palsy for children born after IVF has been seen also in this study, so which was performed in Nordic countries, so Denmark, Finland, Sweden. It actually gives a lot of hope, and the study also correlated this progressive reduction in the incidence of CP in ART children with the reduction in the incidence of multiple births. So once again, probably that's the main cause for the association, but still we don't know. Moving forward, so looking at children at 1 year of age, actually children conceived via ART were found to be to outperform children spontaneously conceived in terms of cognition and communication. Although they had poorer scores in the gross motor, so in motor, in the motor part of the neurodevelopmental assessment, and actually poorer scores in the gross motor part of this evaluation were associated with poor embryo quality. Moving on to cardiovascular. It has been demonstrated that children conceived via ART show premature vascular aging, which is namely an altered vascular wall morphology, endothelial dysfunction, increased vascular stiffness, and that this premature vascular aging has been associated with higher blood pressure levels in young adults. Given the young age of this population, we actually cannot say if this problem that we see in young adults will actually persist further as the child grows, or whether it would lead or not to more severe cardiovascular problems. Indeed, in this study, which is actually the oldest cohort of patients conceived through IVF, there were found no evidence of increased vascular or cardiometabolic risk compared to a non-ART population. So maybe the alteration that that have been found in younger children, they're just transient and they won't mean anything in the future, but we actually do not know. We cannot know still. So moving on to a sad part, that is the oncological risk of children born through IRT. This Danish retrospective cohort study actually found a small but still significant increased risk of childhood cancer associated with the use of frozen embryo transfer, and with frozen embryo transfer only, not with any of the other types, as you can see in the slide. So why is that? Again, nobody knows. We just report these data. It may have something to do, and it has been proposed, with the endometrial preparation. So again, the artificial endometrial preparation, but there are just supposition, hypotheses, and nothing more. These are the studies substantially confirmed the previous results, and this is a study done in Taiwan, actually, yes. And they saw that the ART conception was associated with an increased risk of childhood cancers when compared with children from parents with subfertility who did not undergo ART procedure. And the increased childhood cancer risk was mainly due to the occurrence of leukemia and hepatic tumors. Something happier, so fertility and reproductive health. In this study, the proportion of people conceived by assisted reproductive technology, so ART, who had a registered pregnancy was a little bit lower than people conceived spontaneously. So people conceived via ART, apparently, according to this study, may have more difficulties in conceiving themselves. But these results only apply to the specific time period of the study, of course. We do not know what happens, what has happened maybe after this study period. In the same study, though, there were no greatest risks for women and men who were conceived through ART and actually had a successful pregnancy which resulted in a baby. They had no greater problems, let's say it like that. It is interesting to see that women who were conceived via ART and went on to have a baby themselves actually had more probabilities of conceiving a female than a male. Why? I don't know, but it's interesting. But no differences were found in terms of birth weight or gestational age, so prematurity or not, for the children of people conceived via ART. So this is actually good news. And you can see here this is the lovely Joy and her sister Natalie with their spontaneously conceived children, which are actually a lot. So there is still more to learn about about the potential fertility issues of people conceived via ART, but I don't know, these bode well, I don't know, it's promising at least. So this was basically it. These are my take-home messages, but I would love to hear from you. And just to leave you with just a handful of these messages. ART, yes, can change lives. It makes the impossible possible for people who cannot conceive otherwise. However, counseling must cover both the benefits and the potential risks so that families can make informed choices. And of course, this information must be based on what is available to date, which is not much, as we've seen. There are ongoing improvements in ART technology, so protocols, culture media, lab techniques, they all evolve very fast. And what was true 5 years ago it's probably not true today. So there is no one single study that can really, on the outcomes of children conceived through AERT, that can actually be up to date. So we don't know. But it's important that technological advances don't go way faster than the clinical evidence regarding the health of the children born through IVF. And finally, because the IRT population is relatively young, we are still learning about the long-term consequences, and the longer-term ones are still impossible to evaluate, as well as potential transgenerational effects. We cannot see them yet. So finally, what we need to do is we need to keep collecting data, and registries with long-term follow-up are fundamental. And of course, we should consider all the possible confounding factors, which is not easy. So what we need to do is study, look, study, 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 and just trying to keep and improve our lab and clinical practice day by day. Thank you. This is of course an ICSI picture. It has nothing to do with the presentation, but I really loved it. So I love the little spermatozoa there. So I just wanted to put it there, and please bear with me. So thank you. If you have any questions, I'm happy to answer either here, or you can write to me at my email. So.
Thank you, Alessandra. That was wonderful. Thank you so much. And we're ready for questions.
All dead. That's a very good question, and indeed they most certainly do. When they do like statistical models where they take into account all these confounding factors, the age of the mother, as well as the country of residence of the mother, the country of birth of the mother, those are factors that are considered together. But this is exactly what I mean when I say that there are many confounding factors. It is close to impossible to consider them all at the same time. Okay? And the longer you go in the lifetime of the children, the harder it gets, because of course everything in the environment can contribute to that. So statistically, they try to control by creating models with specific and different, every time different, each time different confounding variables. But
I just want to share my family.
Yes?
My aunt, she actually received the ART for having babies, and she got the twins in her during the pregnancy, and then we can totally find out when these two kids get birth, one of it's bigger than another one, and I feel like there's always maybe there's also an issue because of ART or something, but
an issue because of
the development is really different of these two kids. One is really, really smart and intelligent, and another one is has some emotional problems, and also their height, their weight are totally different. And I don't know, maybe it's because of pregnancy issues, or is it because of the ART?
Other great question, and that is exactly the point of many of these slides. You can't actually tell, I mean, they try to do that and to compare them, keeping this in mind, but gemellarity per se carries a lot of risks, okay? So the easiest thing is what they've been doing so far, so reducing the number of embryos transferred. So you reduce the risk of having twins, you avoid the risk, you eliminate the risk by doing a single embryo transfer. Thus, all that part of risks you get rid of. So that's exactly it. It's a combination of factors, and it's difficult to separate them. Were they preterm, the babies, the twins of your aunt? Were the preterm babies premature? just out of curiosity.
I think yes, my aunt get birth earlier than
Earlier than she was supposed to, and that is another possible cause of different, you see. It's all linked together.
We still did it like, we were so surprised like she did this decision and without any like discussion within our family, and she just did it, and then with 2 babies, and it was just okay, so this is, for us it's like really a high risk because in our family we never experienced ART before, especially she had twins, but fortunately it's safe.
Well, what I want to, if I may, this presentation, I know it may sound a little bit pessimistic, but yes, I see someone nodding, but it's just because that's what the research right now tells us, and it has a kind of a bias, we could say that. It's a little bit biased, and of course you always look for the things that go wrong, but it's not to say that ART should not be done. That's not the thing that we are all saying. The point that I tried to make is that if we know what happens, and even if we know what happens, what goes wrong, we can find out why and then maybe change our practices based on that. So for example, single embryo transfer, multiple embryo transfer. It made sense at the time to do multiple embryo transfers because it increased the percentage, the success rate of the transfer. But then you see that multiple means multiple children, and this carries serious risks. And so you change your practice. So if you see that certain embryo culture carries some risks, then you change it. So you learn, you live and you learn, trial and errors. That's basically life, no? Yes? With, sorry?
There's like an article in the presentation, you had one of the articles.
Yes.
I don't think I can, I know the imprinting, yeah, like the imprinting one.
Yes.
But like Prader-Willi is not, and that's maybe one of the little biases that Prader-Willi has about 15 genetical like reasons. The imprinting is not only one of these. There's like it's mainly imprinting, but there's a lot of stuff affecting if your child is going to be sick by Prader-Willi or not.
Of course.
Yeah, there's like because with Angelman syndrome it's a bit more straightforward, but the Prader-Willi is very complicated. There's like a million stuff that can go wrong and result in Prader-Willi. So that's also like a bit biased, but like I'm also interested in the effect of it.
That's very correct. Both Angelman syndrome and Prader-Willi can be caused by very many different things, and imprinting disorders is just one of them. What I didn't report it here because I couldn't report all the research, of course, but what they found is that children with Prader-Willi and Angelman, yeah, I think Prader was Angelman for sure. They had, if they were conceived via IVF and ICSI, there was a higher probability that they had Angelman syndrome due to imprinting disorders. So they had a higher percentage of imprinting disorders causing Angelman than in spontaneously conceived children. But yeah, you're absolutely right. Like you need to interpret the data and interpret the literature. That's always important.
Thank you very, very much, Alessandra. It's a pleasure to have you here.
Thank you.